Let's find out about our next contestant.
Hi, my name is Mel Wishmeyer. I'm the Executive Director of Trinity Free Clinic. Our mission is to improve health access and equity by providing free medical, dental, and behavioral health care to uninsured and low-income individuals. It's also to help plant seeds of service, compassion, and cultural inclusion in the next generation of healthcare providers.
Please give a very warm welcome to Mel Wishmeyer, the Executive Director of Trinity Free Clinics.
Hi, everyone. Thank you so much. I'm excited to tell you about Trinity's Allied Health Education Program. When you support this initiative, you are actually supporting two great causes: improving healthcare access in our community and also creating entry-level career paths in healthcare. So for 25 years, Trinity Free Clinic has provided free medical, dental, vision, and behavioral health care to uninsured and low-income residents of Hamilton County. We've done this with a small staff of 10 and an army of volunteers. We're the only free clinic that's open 5 days a week, and when patients are sick or have dental pain, they can walk in any of those days and be seen. So y'all remember 2020? Well, healthcare access, for the first time that I know of, became a serious issue for everyone in America. The ERs were full. Primary care doctors were not seeing patients in person. COVID tests were crazy expensive, and that was if you could get an appointment. So Trinity stepped up, and as you can see, we went from 7,000 patient visits to more than 20,000 almost overnight. That's a 279% increase, not in demand, but in actual patient visits. Did I mention we had a small staff? So we had a problem. We needed help, and we received grant funding to hire a medical assistant and a dental assistant. But as we all saw on the nightly news, there was a serious healthcare workforce shortage, and we could not fill those open positions. And that shortage still exists today. So for years, Indiana colleges have trusted us to help their students take what they learned in the classroom and apply it into meaningful clinical experiences at Trinity. Our pharmacy is staffed by 6-year PharmD students from Butler and Purdue, and IU School of Dentistry runs a community health rotation through our clinic. All the rest you see there, they send us nurses and med students and PAs and NPs who all gain valuable clinical experience helping serve the thousands of patients that we see every year. So we wondered if it was time for us to start educating our own students to help fill these entry-level positions. So we went through a social innovation incubator, and we explored this idea from, every angle. So after a lot of work and a whole lot of sticky notes, as you see there, it was deemed viable, and we launched our pilot program just over a year ago. We came out of the incubator with 6 core goals and a solid strategy to succeed, which was focusing on taking the underserved people in our community that we already served and educating them to pass national healthcare certifications where they could come out and earn meaningful wages 1.5 times your typical entry-level wage. So let's meet what they call the alpha class, they name themselves. Angel, she was a pregnant, single, homeless mom, and she had immigrated from Cameroon. She actually gave birth halfway through the program, and she finished because she was so dedicated to this program that she worked ahead on her clinical hours so she could finish on time. She only missed 2 days of classes. JJ was a 17-year-old who was living on her own. She graduated high school early to begin working and supporting herself. And Celia worked at our front desk, and Gabby's an immigrant and a seamstress from Mexico who now wants to be a dentist. All of these students spent 1 day in the classroom and then 3 days in our clinic serving the underserved. 100% passed the course. 100% passed their national radiology exam, and 100% were hired immediately after graduation, making twice what they did before they entered the program. These are the next two programs are medical assisting and our Bridging the Gap program. So we're not done. Take a look at their faces because they reflect the faces of the patients that we see every day, and they are helping to create a more caring, cultural, inclusive healthcare workforce for our community. They all look pretty proud and happy, and we're pretty proud too. We couldn't have done it without all the partners that you see here who have provided funding, mentoring, pathways to certification, and so much more. This program is not a Band-Aid. Your investment provides a pathway out of poverty through education and strengthens our ability to provide free medical and dental services to thousands of patients each year. Thank you.
Is there a wait list for services, or how many people are you unable to serve due to capacity?
The only wait list that we have is for vision, and that's such an important, you can't do well in work or school if you can't see, but it's a pretty short wait list. And what happens is we have community doctors who actually, when the wait list starts to build up, we'll actually have 2 days of seeing patients like crazy. But none of our other clinics, during the pandemic, there was a work list, but we don't have one anymore.
Could you clarify your service area
Oh, yes.
and how many locations you may have?
Yes. So we serve Hamilton County residents, and it's those who are at 250% of the poverty level or below. So Hamilton County, and we just have one location at this time, but the health department would love for us to open a location in Noblesville. Thank you.
Really appreciate their work. I mean, it is not uncommon that communities have free clinics in America, but it is uncommon to have a free clinic that is also taking on workforce development challenges in addition to health. So really innovative approach. Really appreciate the work that they're doing for residents there, especially on that north side of Hamilton County.